What would you do if a stroke started right now? Not tomorrow, not in a hospital, but here, at home, on the street, next to someone you care about. Would you recognize it? Would you act immediately? Or would you hesitate? Because with a stroke, hesitation is the difference. Not hours, not days, minutes. Every minute matters. Most people think a stroke is obvious, sudden, severe, something you cannot miss. But in reality, it often starts quietly, with small changes, subtle signals, things that don't feel like an emergency. And that's what makes it dangerous, because people don't act. They wait, they question, they delay. And during that time, the brain is losing blood. Today, we're going to talk about what to do when a stroke starts, before help arrives. Because this is not just information, this is something you may need one day for yourself or for someone close to you. When that moment comes, there is no time to think, only time to act. Let's begin with the most important thing, recognizing that something is wrong. A stroke often begins with sudden weakness on one side, trouble speaking, confusion, vision changes, loss of balance. But here's the problem. These signs may feel mild, temporary, unclear. You may think, it will pass. It's nothing serious. I'll wait. And that is the moment where everything can go wrong. Because when a stroke begins, blood flow to part of the brain is interrupted. And without blood, brain cells begin to suffer. Within minutes. That's why early recognition is critical. Now here's the simplest way to identify a stroke. It's called the FAST method. F. Face: ask the person to smile. Does one side of the face droop? A. Arms: ask them to raise both arms. Does one arm fall down? S. Speech: ask them to say a simple sentence. Is their speech slurred, strange, unclear? T. Time: if you see any of these signs, act immediately. This method is simple, but it saves lives. Now step 1. Call emergency services immediately. Do not wait. Do not see what happens. Time is everything. Now step 2. Keep the person safe and still. Help them sit or lie down. Avoid movement. Because movement can worsen the situation. Now, step 3. Do not give food or drink. This is very important. Swallowing may be affected. This can lead to choking. Now, step 4. Stay calm and stay with the person. Do not leave them alone. Talk to them. Observe them. Monitor changes. Now here's something important. Symptoms may come and go. They may improve slightly. And this creates a false sense of safety. People think it's getting better. But the problem is still there. And this is where delay happens. Now imagine this: the person feels weak, then slightly better. You decide to wait. Then, the condition worsens. That is how many strokes progress. And that's why early action is critical. Now, let's go deeper, because understanding what's happening helps you stay focused. A stroke happens when blood flow to the brain is blocked, or when a blood vessel ruptures. In both cases, the brain is deprived of oxygen. And without oxygen, cells begin to die. This process starts quickly and continues as long as blood flow is not restored. That's why minutes matter, not hours. Minutes. Now ask yourself honestly, would you act immediately, or would you hesitate? Because in that moment, that decision matters. If you take one thing from this part, let it be this: do not wait for symptoms to become severe. Act when they begin. On your brain is giving you a signal. That signal is time. Now here's the part most people are not prepared for. What if the situation gets worse? What if the person suddenly becomes weaker, more confused, or collapses? Because a stroke does not stay the same. It can change quickly, and when it does, you need to act without hesitation. Let's continue. If the person is still conscious, but symptoms are getting worse, your role becomes critical. Stay with them. Keep them safe. Keep them still. Now here's something very important. Do not let the person move unnecessarily. Even if they say, "I'm okay, I can walk," movement can make the situation worse. Now imagine this: the person tries to stand, they lose balance, they fall. This is common, because a stroke affects coordination. So keep them seated or lying down. Now let's talk about a critical moment. What if the person collapses or becomes unresponsive? This is where most people panic. But panic does not help. Action does. First, check responsiveness. Call their name. Gently try to wake them. If they do not respond, check breathing. Look at the chest. Listen. Observe. Breathing is present, place them on their side. This helps keep the airway clear. Stay with them. Wait for emergency services. Breathing is not normal. This becomes a life-threatening situation. Immediate action is required. Now, here's something very important. Many people freeze at this moment. They are afraid to act. But doing nothing is the worst option. Even basic action can help. Now let's go back, because most situations do not reach that point immediately. The critical window is before that. What you do in that window matters most. Now let's talk about mistakes, because this is where outcomes change. Mistake number 1, waiting to see if symptoms go away. And this is the most common mistake. People delay, they hesitate, they hope. During that time, the brain is losing oxygen. Mistake number 2, ignoring mild symptoms. Thinking, it's just dizziness, it's just fatigue. But strokes often begin with mild signs. Mistake number 3, giving food or water. This is dangerous, because swallowing may not work properly. This can lead to choking. Mistake number 4, letting the person move around. Movement increases risk and can lead to falls or worsening symptoms. Mistake number 5, panic. Panic leads to confusion, and confusion leads to delay. Now let's go deeper, because understanding what's happening helps you stay calm. During a stroke, blood flow to the brain is interrupted. This affects movement, speech, vision, balance, awareness. That's why symptoms vary. Some people cannot speak, some cannot move, some become confused. But the cause is the same. The brain is not receiving oxygen. Now think about this. What if symptoms improve slightly? This is dangerous, because it creates false confidence. People think it's getting better, but the problem is still there, and delay continues. Now, let's make this very simple. If you remember nothing else, remember this. Face change plus arm weakness plus speech problem or ACT. Immediately. Now let's talk about time again, because this is everything. The brain begins to suffer within minutes. And the longer the delay, the greater the damage. But early action can change the outcome. Now imagine two situations. One person acts immediately, calls for help, keeps the person safe, and the other waits, hesitates, delays. The difference between those two situations is time, and time changes everything. Now ask yourself honestly, would you recognize these signs? Would you act immediately, or would you wait? Because in that moment, there is no time to learn, only time to act. If you take one thing from this video, let it be this. A stroke is not something to wait on. Act immediately. Your brain will always give signals through sudden changes, through unusual sensations, through things that feel not right. The question is, will you act when it matters? If you found this video helpful, stay with our channel. We explain critical health situations in simple, clear ways so you can act when every minute matters.